I'm Gordon Weir and work at the Joslin Diabetes Center and direct the diabetes program of the Harvard Stem Cell Institute. I've been very fortunate to be able to work with patients, and it provides me with a constant reminder of what the diabetes problem really is. One of the things that's appealing about the diabetes problem is that conceptually it's simple. We want to give back the cells that are missing. So in type 1 diabetes, there's profound deficiency, so you want to give back 100%. But with type 2 diabetes, there is a reduction of about 50%, so you'd have to give back 50%. But in either case, if you give back enough of the insulin-producing cells, you end up restoring the blood sugar levels, and it's the blood sugar levels that cause all these complications. The HSCI has two approaches to getting more beta cells. And one approach is human embryonic stem cells. And that is being done with a combination of identifying small molecules that will push human embryonic stem cells to insulin-producing cells and to stepwise growth factor approach. The other approach is to increase the replication or the division of existing beta cells. The idea behind this latter approach is that you might obtain islets from a pancreas of a cadaver donor. Then, if you had the right molecules and could make them divide and expand the number, that then you would also have enough for transplantation. So in order to get from a human embryonic stem cell to a mature beta cell, you've got to go through several steps. You start with a very primitive human embryonic stem cell, and you've got to move that along to what's called endoderm, and then to a precursor cell that can make a new pancreas, and then to a precursor cell that can make new islets, and then to a precursor cell that can make the actual insulin-producing beta cells. And there's been some success with that using various known growth factors. But what Dr. Melton wants to do is to identify small molecules so that the process is better defined. In particular, if you have cells that are programmed so that when they become a pancreas precursor cell, the cell turns red or green, then you can identify that. So that allows one to screen small molecules, so you can test thousands of small molecules and ask the question, which molecule will make that cell turn green? And he's had some wonderful success with that. We're eager to continue with this and combine this with the growth factor approach. And we think that the combination of small molecules and known growth factors will allow us to get a test tube full of mature beta cells that can then be transplanted into people. The Melton Laboratory has had big success just in the past year in converting other pancreatic cell types to islets. And in particular, most of the pancreas is made up of cells that make digestive juices. That's really what 98% of the pancreas does. And by introducing just 3 genes into these cells that make digestive juices, cells that are called Asner cells, the Melton Laboratory has been able to convert these cells to insulin-producing beta cells. Certainly one of the most exciting things that's happened in the past couple of years is the concept of IPS cells, which are induced pluripotent cells. So if you have someone with diabetes, you can obtain a skin biopsy from that individual and make IPS cells and make beta cells that come from the same genes as the person you took the skin biopsy from. So if you take that individual with type 2 diabetes and you take a skin biopsy and make the IPS cells, make new beta cells, you give them back, there will be no rejection. It should be taken beautifully. I think the real strength of HSCI is the development of new technologies, and new technologies appear every few months. So right now we're doing a great deal with high throughput screening. We're doing a lot with new ways to make iPS cells, but there are incredible things happening with new biomaterials and tissue engineering, and that fits very well into what goes on with stem cells. As we move forward with this new technology, it would just be so exciting for me to be able to have some of my own patients be able to receive new cells that are generated from embryonic stem cells or some other pathway. As I said, there are perhaps multiple ways that you can get the cells that we need.